portion of the meeting, which is the first 2 hours. And we also either have or are anticipating having Representative June Robinson and Representative Joe Smith participating. And I know we've had several people who've had traffic that have been welcome. Several people who have traffic issues, so we will still have some stragglers coming in. And also, we will expect Senator Brock or his staff person, Daniel Strauss, will be participating in subsequent meetings here in Seattle. The task force, which is part of the Healthier Washington initiative, which you will all be more familiar with as the day goes on, is sponsored by, the task force is sponsored by Dorothy Teeter, the Director of the Healthcare Authority, and John Weisman, Secretary of the State Department of Health. We have also had a strong engagement by the Department of Social and Health Services, as they've been incremental in the project. We are also engaged with Healthy Generations. They're assisting with the task force, and Robbie K. Norman will be our meeting facilitator. So I'm going to turn it over to Kathleen now, and then we will go to Robbie K. And we will, just for people on the webinar, we will have people who are shifting positions, and we will have a panel set up. And so there will be some transition periods, which will give you a moment to think about the rest of your world. So, Kathleen?
Thanks, Rebecca. My name is Kathleen Clark. I'm with the Department of Health and work with the Healthcare Authority and DSHS in the Healthier Washington initiative. And I wanted to welcome you all here as well, and also welcome the people who are on the webinar this morning. I'm going to set some very broad context for you, and so today, when we're talking about health care, we are speaking broadly about both behavioral health, which includes mental health and substance use issues, and we are speaking about physical health, including oral health. When we are talking about the health of a neighborhood or a community, we are speaking broadly about the environment and policies that help human beings be healthy. And when we are talking about community health workers, we are talking about the term, we're using the term broadly to include peer support, doulas, and others who work in community health. Our meeting objectives for today are to launch the Community Health Worker Stakeholder Engagement Process. Very exciting. Some of us have been working on this since April. Then also to establish a common understanding of the importance of community health workers within the context of the Healthier Washington initiative, roles for the community health workers, and the other common understanding that we hope to come to today is the task force charge. So we all know we're very clear about what we're doing. And then we today will also have time to get initial feedback on the role of peer support and community health worker and doulas and, again, all of that broad topic that we're using the word community health worker in. So with that, I'm going to turn this over to Robbie K. Norman, who is going to be our facilitator for the day.
Thank you, Kathleen. So a couple of housekeeping pieces. In the back, there are light refreshments, so please feel free to get up and at your convenience and access those. There is bathrooms out the door and to the left. And then I just wanted another reminder about the Wi-Fi issues so that we don't lose our folks on the webinar. I want to make sure that happens today. Also, Victor, can you stand up? Victor in the room? Victor's in the back. Victor's in the back. And he's going to be floating around today getting some pictures, so we just wanted you to be aware of that. And he will have a photo release form if you wish to sign that for him. I appreciate his support today as well. So what an exciting day today. I'm honored to be supporting this conversation with you today. More importantly, really honored to see the leadership that's really in this room. We won't have enough time to introduce each and every one of us in this room today, which is a really important piece of the work. and you'll get opportunities throughout the day to really get to know each other and work together. But what we want to do is take a minute for all of the CHWs. Please stand up today. Can you stand up for us today? You can stay standing because this is really about you. And today, stay standing. Let's see if we can stay standing. Today, we're co-creating today the community engagement destination. And what's amazing about this is that your authentic voice is what's critical to these really hard conversations that we're about to embark on. We're so excited to do this together. And the leadership from Dorothy and John, who I'll introduce here in a minute, they have said this is the way we're going to do business. Community wisdom is the center of decision-making from here on out for Washington State to create healthier Washington. And so we want to not only thank you, but also thank John and Dorothy for that leadership today. So thank you. My pleasure also is to introduce Dorothy Teeter, the Director of Healthcare Authority, and John Weisman, the Secretary of the State Department of Health. And this is where they began this conversation of this community engagement as a commitment, and CHW is a workforce innovation for creating a healthier Washington.
We do this to everyone who comes to speak. It's a webinar. So they can't hear it all. Okay. I'm not going to use the bell, but if somebody says I'm talking too long, they can, John, you can put up. I'll give it to Don.
More likely you're going to get me the bell.
So can you all hear me? Okay. Good morning and welcome to this beginning. John said you're ready. Okay, so I want to show you guys. It doesn't ring. It's just up there for decoration. So, all right, John, bring away. So we wanted to really welcome everyone here today. This is a mix in this room. It's an unusual mix of people gathering. We've got some very high-level leaders of big organizations here, as well as the community health workers who can tell all of us what's working and what isn't as we go forward. I think the one common thread that I've observed is that everyone in this room really understands the linkages that have to get made between the community, people that live in those communities, and the systems that those folks in our communities live and work with every day, and how to improve those. So, again, it's an unusual, and I'm really looking forward to a very creative group of people here that can help us move forward. So, with that, I've been asked to do a little bit of an overview of Healthier Washington from the perspective of the Healthcare Authority, and John can speak a little bit to why we are partnering on this. We know that because we purchased health care for, close to a third of the state of Washington, it's not in Medicare, that we have a huge opportunity to ensure that the way we spend our dollars really reflect the needs of those people who live in our communities. And to build those linkages that we have seen lots of early returns work when you have your communities engaged with your healthcare systems, engaged with your public health departments, engaged with your accountable communities of health, all of that working together can actually yield awesome returns, both in financial management of dollars, but also in terms of improved health for folks. So my role as the Healthcare Authority on this is to ensure that every penny we spend is being spent well in terms of building really good healthcare systems, but also those that are responsive to the needs of those in the community. And the way you do that is, of course, by linking with communities and, at the end of the day, with community health workers, so who can tell us what's actually going on and what's needed. So let's get started on overview of Healthier Washington. I'm going to apologize in advance because I know some of you have seen these slides more than once.
and yet others maybe haven't. And so we wanted to ground everybody in this before John talks more about the vision for the community health workers themselves. The Healthier Washington, thank you, has 3 goals. And this is like, underneath each one of these is a lot more that goes on. But one is, again, building healthier communities through collaborative regional approaches. So you'll hear a little bit more about this in a few minutes. But the state is a big place, and so we really need to focus a little bit more at a granular level, whether you're purchasing care for the state or whether you're these linkages at a more regional level so that you can, again, get a more clear voice of the community. The collaboration is really important. I think Robbie used the word co-creation. We're trying to do as much of that as we can while at the same time ensuring that there's some consistency across the state so that we end up knowing what's working and what isn't at a different level. Making sure that health care focuses on whole person. When we say whole person here, it's probably some people it's obvious, and why on earth are we saying this? But the whole person really means that we integrate the care and services for those folks that need health care in the physical sense as well as in the mental health or behavioral health sense. So right now we've got an opportunity ahead of us to integrate that care in a more logical way so the person themselves does not have to navigate many, many systems if they need care for depression on one side and care for diabetes on another. You can actually find your way and navigate those systems in a way that is much more coherent and integrated because, after all, none of us walk around with our heads over here and our bodies over here. Well, some days we might, but we're not supposed to, and we want to really make sure that that doesn't help. And that from the state level on down, we're creating the voice of that whole person care. So when John's out there, when I'm out there, Kevin Quigley's out there from DSHS, we're all asking the same question. Are these services right for the whole person care that we need and the whole person experience in the community? And last but not least, and I mentioned this earlier, it's improving how we pay for services. Again, we are moving at the state level from a fee-for-service approach to care. This is going to be important for the community health worker concepts and ideas about moving this forward. Right now, we are moving at the state level to purchasing much more for outcomes so that you're not saying, I'm going to pay this particular worker to do this particular service on this particular day with this particular doctor. We're trying to get our systems to think more about the whole population that they're accountable for, so that, and then give some dollars that associate with that, so that for a community health worker, the question no longer will become over time, how can I get certified, licensed, etc., so that I can be part of the reimbursement system, but rather, how can our systems, who are now going to be much more accountable for this whole person care, ensure that they're able to engage in an effective way, community health workers, and have the dollars that they need to pay them built into their system. So it's a little bit of a complex concept that we'll be working on over the next 5 months, but I think conceptually, as we're moving away from paying for widgets, if you will, to paying for the whole person and the whole system, we'll be wanting to do that. So I think that the issue with community health workers builds right into that. Okay, next slide. This is another slide that many of you have seen, and I want to make sure that we interpret this right. When you look at health of a person, or a community for that matter, the services they get in a healthcare system are absolutely huge. They reduce stress if they're done well. That counts for a lot of health. But at the same time, where you live and work and play, for that matter, really also has an effect on you. How you personally behave in terms of your own health. So we're trying to really understand how those things interplay. The most recent research on this would say that the healthcare system can contribute to health stat, not getting you better in terms of you're sick, but in terms of overall health on long term. That's maybe a 20% piece of it. How you behave as people, health behaviors, you take care of yourself. How can a health system help you, remind you to go get your immunizations, for example? That's partly on the person and it's partly on the system. So we're just trying to focus, again, and John was making more of this, about the impact that overall factors have on health and not only on the healthcare system itself. Again, this is just a quick slide to show that the Healthier Washington Initiative, which again was it's a combination of things. We had legislation in 2014 that helped direct the work that we then reflected in an application we made to CMS, the Innovation Center. There's a STEM grant down there to get dollars to actually carry forward the vision of the legislature on Healthier Washington. And then now recently, some of you may have seen that we're also trying to pursue an additional approach, which is additive, complementary, and hopefully, if we can work this through, we have an application in right now around Medicaid itself, the transformation of those services, see if we can even help accelerate this vision that the legislature is giving us on Healthier Washington even more quickly with a demonstration project around that. So this is a lot of things coming together. The grant itself, the Healthier Washington grant, we are almost finished with our design year around that. That's why this work is really important to help us feed into the actual implementation, year 2, 3, and 4 of this grant. CMS learned from the first set of awardees with the state that people need a year plan. And so that's what we're in right now, and that's why this design work is so important. Okay, next slide. The accountable communities of health, this is just a map. You'll hear more about this. This is our attempt. Really, again, I would actually not call it an attempt because it's kind of remarkable how regions across the state pretty much self-identified into these geographic regions because there are different parts of the state and they represent different populations. We need this regional approach. This is our the approach and the organizational construct we're thinking of to get that voice of the community really deeply embedded in our state so that when we're trying to figure out the strategies and the priorities for healthcare, health improvement, and healthier communities overall, we've got a regional focus for that. And those are the regions. You can see them right there. Okay. I'm trying to speed up now, John, because I know you've got some time here, too. Really important, he's ringing the bell. Really important piece of this, which, again, awesome work by our state at the direction of the legislature to come up with a core performance measure set for our health system that we will all use to measure how we're doing across the state, whether it's building it into our purchasing contracts with our healthcare delivery systems, whether it's working with ACHs to help improve health. These are the measures. We'll have a core measure set consistently measured across, and that will be the foundation upon which we can continue to innovate and improve. Okay. Again, paying for value. I talked a little bit more about earlier, so I'm not going to dwell on this, but the concept here is that we absolutely know because of a lot of the demonstration projects that have gone on nationally, if you improve or change the way you pay for care, you can improve the quality, improve the health, and stabilize the cost trend. So that's why we're moving away from this concept of fee for service. If you just think about it conceptually, the more you do, the more money you make. The more fractured the system is, the more money everybody makes. And it may not, in fact, help the person that's receiving care. So lots of amazing leadership in this state from our health system to help us move this work forward. And we've got 4 payment models that we're using to try to test out what's going to work for them. Integration of physical behavioral health. Again, here I already talked about this. Really important. Whole person. How do you integrate the services so that a person themselves does not have to navigate multiple systems to receive the care they need for themselves as a whole person or for their family. Okay. I'm going to turn it to the next. I'm going to turn this over to to John now. He is my partner in crime, or partner in good health, I guess. And he's gonna take us forward into how this background links into the focus for today.
Good morning, everyone. It's absolutely great to be here and great to see all of you. We have a huge transformation ahead, as you can tell, as you've listened to some of what Dorothy has talked about. And this means that healthcare providers and the health system need to transform. We need to look at how we approach care differently. And most importantly, how we engage individuals in that well-being, in their own well-being, and taking action. Part of the way we are going to be doing that in the work that Dorothy described is supporting practices in transformation. And the Department of Health has got the lead for helping do that through the Practice Transformation Hub to support primary care providers and others as they're needing to navigate this change, the system change that we're talking about, where you go from actually thinking about the broadest parts of health, that integrated piece, where you stop thinking about the individual components of service, but really look at what you're trying to achieve in health as a whole. So we know to make that shift, to make that change, we've got to think about team-based care. No longer is this about individual provider or person on the team doing their piece of the scope of work, but it's how as a team do we work together, and how as a team do people work at their highest level of their training. Community health workers are key to this piece of the team-based work. And I'm going to say a bit more about that in the next slide and the one after that. Yep, go back one. So really, when we are talking about health and trying to improve health, we are looking at community. Some of you are probably sick and tired of hearing me say this, but when I interviewed with Governor Inslee for this job, I said, Governor, when we're talking about health, we need to remember health occurs in families, health occurs in neighborhoods, health occurs in communities, where people really live, learn, work, play, worship, get their health care. That's where health really happens. And so when we look at health and population health, this is about thinking about how do we connect clinical care with community. This is about how do we have communities where folks can get healthy food. So if you live in a community that's not on bus routes, you have no supermarket next to you, you have corner stores, we need those resources in that community to have healthy options for folks. We need the ability to get around our community. We need communities that have sidewalks that people can safely get out and navigate. So all of this comes together as we are rethinking the health system. And no longer can we have public health here and healthcare over here. This is about now all of us coming together. So this is really cross-cutting in terms of population health. And that brings us to the community health workers. Dorothy and I are incredibly passionate about the opportunity and the resource and the skill sets that community health workers bring to this effort. Community health workers are that link. They know their community. Because oftentimes they live in the community, they live in the neighborhood. They are from the culture of the folks who are receiving care. They speak the language, not just the language of English or Spanish or whatever, but the language of knowing each other, the language of culture, of community, of that knowledge base of what resources are there. You know who the informal leaders are in your community, as well as the formal leaders. But those people who are trusted individuals that others listen to, that knowledge that community health workers bring to health and to health care is an incredibly important link that has often been missing. So we are really excited about that piece of knowing the culture, that sense of place, and how does that then translate to somebody's well-being and the resources that they have, the supports that they have to actually be healthy. So as you can see, community health workers do all this. And those of you who are community health workers here today, you know that. is so important that you're here today and in this process as we move forward, because we need to tap into the knowledge that you have. And the knowledge that you have of working with different individuals and telling us, well, what does this tell us about gaps in our community? Or what does this tell us about gaps in the care we're providing? How do you inform the rest of the team that you're on with the knowledge that you have that allows people to take control of their health and be successful and the resources they need? So your voice here is so important, and Dorothy and I are both asking you to please use your voice. Do not be silent in this. Raise your concerns, and if it takes a lot of courage to do that, I encourage you to have that courage, and I suspect you already do, which is why you're here. So the task force charge really is pretty broad, and I want to talk a little bit more about it. But this is about actionable policy recommendations that can align with all of the things that Dorothy and I have been talking about. The pieces of healthier community, and that piece of the whole person, and how do we treat the whole person. So as we do that, we're going to need to be thinking about what is the role of the community health worker in that team-based approach. And we really want to make sure that the community health workers are a part of that team. So what roles can they play? And there, as Robbie said, I think it was Robbie in the earlier part of this, or someone did, there are various names for community health workers. So we're talking about all of those folks. What's the role that they play? What kind of training do community health workers need to be able to do their job and to be a part of that team and to be able to fit into that team? And frankly, I would say, what kind of training do you give the rest of us also to really be real about what's happening? And then thirdly, what are the supports that are needed for you to be successful? So training is one thing, but then there are the supports. What supports do you need? So this is an incredibly important task, but we know, Dorothy and I know, that the group of people we've assembled are up for this task. You're going to really be able to balance, I think, and have conversations that balance the value of the relational aspect of the community health workers and the knowledge of their community, along with the evidence base for the community health workers. So there is evidence base out there for this. This is not a new concept. It's one that's been around the world for a long time. And so we need to take the wisdom in that many, many hundreds of years, truly, of community health worker experience and bring that to this process. So we want to recognize everyone who's in the room, and those of you who have hired community health workers, thank you. Thank you for saying that's an important part of the team and recognizing it and bringing it forth. So we're excited about the day. Dorothy, I don't know if there's anything you want to wrap up on this part.
Robbie said that if there were questions.
Okay. So Dorothy's saying, for those of you who might not hear us on the webinar, those of you, if there are any questions that you might want to have initially for Dorothy and me, we'd be happy to take those. But I do know that we're excited to have you all here and that we have a lot to do today. And so, Robbie, I'm turning it back to you, Emily.
Okay. Let me thank John and Dorothy. So that's just the table that was needed to be set, and the inspiration and motivation for some challenging and exciting conversations ahead. And I know that we're all up for that challenge. So the planning group has been tirelessly working to ensure that this really kept community wisdom at the center of even this process. And so in light of that, we want to stay true to that and invite up Veronica Sosa from Quincy, Washington, who is a community health worker who's been tirelessly working in this area. And she's going to just share with us just one quick story about why we continue to do this work.
Thank you, Robbie. And it was hard for me to think of just one. So I will share with you one that will always be on my mind and in my heart. Yeah.
There's sound.
Is this better? Maybe I was just trying to. How about this? Oh. I'm a community health worker, not a singer, so I don't know how to hold the mic. So just really quick, it was early on in my community health worker experience. Well, I've always been a community health worker from toda a salud. I would say, since I was, helping my mom navigate things. But one night, I was driving home a young high school student from a women's justice circle that we were putting together for high school students with Mary Jo. And I was driving her home, giving her a ride home, and she in the conversation began to share a story of her uncle who had just recently passed away. And he shared with me that he had cancer, and they didn't find this out until after his death, and he kept working throughout all his symptoms. And I asked, well, why? Why would he not go get treated? What was going on? Why didn't you guys know? Because he was afraid to rack up bills, because he was afraid to get deported. And that, to me, obviously the story itself is very shocking that somebody wouldn't seek treatment because of that fear. But when I dropped her off and I kept pondering about this story, I kept thinking, why did she trust me to tell me this? Why did she? Obviously, it was very close to her heart, and she felt like she trusted me, and she felt like she needed to let someone know. And that, to me, is just that trust that she had in me. But then furthermore, why did her uncle trust us? Why did her uncle trust the system? Why wasn't there somebody there to let him know that it was okay? So with that said, I in my career as a community health worker, in my life as a community health worker, I began to see more and more the importance of community health workers out in the community, to be trusted, especially those community health workers that are part of the community. I felt like she trusted me because she knew me from it. We grew up together in the high school. She saw me, so I think that's somebody mentioned that it's really important that community health workers be from the same culture, same language, same community. And I was part of her community, and she trusted me. So that stuck to me.
That's really what this is all about, right there. So, thank you so much, Veronica. Let's take a deep dive now for a minute in really what's happening across Washington. So I want to introduce Kathy Burgoyne, who is the Director of Applied Research for the Foundation for Healthy Generations. And she's going to moderate a panel discussion today. And it's really just about setting the context for Washington, what's really happening in the field in Washington State, and also taking a little bit of a national look as well.
Okay, panelists, come on up. That's the most important part. And while people are coming up, right, we have identified who the community health workers are in the room, but we have a lot of other people as well. Could you stand up if you work for one of the health plans so that people know who's in the room? Okay, so here are your representatives from health plans that are here. How about, thank you, how about from health systems, health services? More than one? Yeah, that's good. Well, and so you'll find later if we say, okay, we have some sector groupings that sometimes there are unusual creations. What about community-based organizations? Housing, local. You are everything. I really need to know who you are. Labor. I know you more. Okay, so Tracy, maybe you are it. Hey. Education. So college, community colleges, college systems. Oh my gosh. I did not plant her, but everybody, if you're wanting to do networking, well, right, because Tracy's been really involved in some of these grant cases. But we really only just need to network with one person here from the other systems. Okay? And then clinic associations that are related to clinics, hospital associations. Part of what I'm really just wanting to do today, I know I miss people because I always miss somebody. Oh, local health. Duh. Yeah. That's right.
How about policymakers?
Policymakers. We introduced representatives originally. So June's here. Representative Schmidt here. American Indian Health Commission, the tribe. Right? And on some level, I'd say policy influencers, because then we would all have to say that. And then the one other group of people that I desperately want to give thanks to is you have had a number of students from the University of Washington. Holy Toledo. Usually I'm the one that does that. Who have done the organizing around the name tag, set everything up, greeted people, had people come in. Can our students come on up because they have been, or stand up because they have been our organizers. So I actually have nothing to say beyond introducing people because John already said it all. So I'll do really quickly here. Our panelists here have deep wisdom about what it means to be a community health worker in a wide variety of systems. Mary Jo Ibarra-Vegas works in a clinic in Quincy, Washington. Marguerite Rowe is Public Health Seattle, King County. V. Lee is rocking, because I can say this because I know her and have worked with her, lead community health worker with Mercy Housing. Kathy Olson has immense passion from Molina Healthcare, so one of the health plans that has not only a local investment, but a national mandate to use community health workers in all of their work. And then Carlos Carrion, who's Cal's Health and Human Services. Carlos is kind of everything. He's public health, he's human services, he's behavioral health, and so we were talking about it, and because we're about the same age, we said, yes, because we're old and we sort of then all the way around these multiple positions. And then Representative June Robinson is here, both as a policymaker, but also somebody who's worked in migrant health and supervised community health workers for decades. Right? So it's just nice to know that inside policymaking circles we have someone with this knowledge. Okay, are we good? Okay, so just what I was asked to do is to give a little context, not only related to Healthier Washington, but where we are in the state and where we are nationally. So community health workers are frontline health workers. They are the trusted members of the community. Now, I'll ask those of you who are not community health workers, because actually on some level, we all serve this function, we just don't own it. So I know none of you have ever had a problem with your child. And you've never really reached out to anybody to say, what the heck is this? But I have. And who did I talk to? I talked for 973,000 hours to the other women who had kids the same age as were walking up and down the soccer sidelines, right? I did not talk to my pediatrician, sorry folks. The other moms in drama, so June, unfortunately, has had to listen, her kids are just a little bit older than mine, and she has had to listen through all the high schools, like, okay, now what do I do, right? So through all of our lives, we're reaching out to family, friends, and neighbors, and we identify our trusted community health workers. This is a way for our systems to network into those trusted social networks. They provide education, and the thing that is unique about community health workers is their lived experience in the community brings something that if you're not a part of the community, you don't actually have. I want to have it. Lots of times I think I have it. Sometimes, if I'm really honest, I pretend to have it, but I don't have it. At least outside of my particular social network. And like that. So I can say this because I am a recovering mental health professional. Right? And as a mental health professional, working in schools, doing adolescent day treatment, I can also claim education. What we do in our systems is we have an immense amount of knowledge about mental health, about recovery, about education, about medical services, and we, in this outside ring, we take this expertise and we come into communities. Right? That's our job. And it's a really important job because communities do need that kind of support. What community health workers do, next slide, is they have the inside-out approach, which is also incredibly valuable. But really, we're only going to be really valuable if we have this together. We have that expertise from our various disciplines, and we have that expertise from the inside out. So what I really want to encourage you to do is over our meeting times, if we can network with one another and start building those bridges now, right, we'll be more effective doing that in our community. Okay. I'll just say, if you want to go to the Happy Gen website, we have a bibliography, and you can read all of the academic articles that you would like. And I can tell you that we have very solid evidence about community health workers being effective in preventing and helping people to control chronic diseases, that they make the patient care experience better, which leads me to this. We have interpreters here because we wanted to make sure that we really had voices from multiple communities here and present and engaged. Thor, you, Mercedes, wave your hand. You guys rock because that's being provided to us by one of those agencies that are deeply embedded. So it will make the experience better for people. And then last but not least, I know that everything is about money, but a lot of things are about money. So I'd say the range, when I look at the articles around what the investment is for every dollar invested, you save 8, but the average is 3 to 1. So that meets all of our big goals for healthcare reform. Okay, and last but not least, this is the piece that I think most often we leave out. Community health workers actually can help us be better problem solvers. They have solutions. So I'll give you one story on myself. So I do some work on the east side of Tacoma. And the community health workers there, people there were saying, we don't walk, we don't let our kids out to play, we don't do those things because it is just not safe here. I'm an academic. What do? I go to the data, and I look at them, and I say, in this neighborhood, you have the lowest crime statistics of anybody on the east side of Tacoma. What do you mean it's not safe here? And they looked at me and said, it's not about crime, it's about dogs. We have packs of wild dogs that are running around here, right? And where we really need a partnership is with animal control. Right. I had the data, but I actually didn't really know what it meant. community health workers can really bring that voice. So that's the intro around how it is that we are better together. Even though I know that phrase has been used 1,000 times, still we are better together. Okay. Mary Jo, you're on. And now I get to be mean because I am keeping people to a 5-minute time. That's my job.
So I think Kathy thought that I was going to be doing a presentation, but that's not the way it's going to be. I think there's some individuals who have received little cards. If you stand up, please. So one of the things I wanted to do this morning, in true promotora fashion and low tech, Aztec, no PowerPoint presentation at all, because that's not what we do. How we roll is that you guys participate because you're part of the community. So if you guys would please just one by one begin to read what's on your card, and this will kind of give you a picture of what we do in community health and in migrant health centers. If you would like to read it in Spanish, please do so. They are split up in 3 or 4 sections. One is qualities of promotoras. Those are the green ones, for those of you who are green. And then I have some blue cards, and they have our services or ways that promotoras help provide. And then the kind of pink salmon color, I don't know what that color is called, the contributions of promotoras. And then the last one is kind of a icky brown, I don't know what color it is. And it's as a volunteer you can. So let's start with the green one. If you guys can go ahead and start.
And we're going to be speaking to the mic for the webinar.
My stars are going creativity and resourcefulness.
Cualidades de promotores, qualities of promotores, respetuosidad y amabilidad, respectfulness and kindness.
Cualidades también de una promotora, qualities of promotores, ansioso por aprender, abierto a nuevas ideas, eager to learn, open to new ideas.
They identify the needs of the most vulnerable and they defend and advocate for them.
Qualities of promotoras, strength and courage. Qualities of promotoras, understand and respect the beliefs and traditions of people.
Desires to help the community.
Persistence and attitude. Community resource line. Guía de recursos comunitarios.
And community health workers provide assistance with difficulties caused by language and cultural barriers.
Advocacy services. The quality of a promotora is to be a good leader and orderly.
They also provide asesoramiento informal y de apoyo, informal counseling and support.
They also provide fill-out applications and forms.
They also provide a link between communities and health and human service agencies.
Promotoras provide capacity building on individual and community levels. Promotoras improve adherence to health recommendations.
Educación popular para la salud, popular health education. Facilitate patient-provided education.
Helping people understand the health and social service system.
Improving access to social and health services. Improving overall community health status. As a volunteer, I can assist you through the school.
Promover la salud en su comunidad. Promote health in your community.
Is that it? You guys, thank you so much. And it's so good for the cards to be read by community people, even in the room, because it just brings about the kind of work that should be being done at the community level. And especially in community health centers and migrant health centers, honestly, it seems that we are just a huge group of people think that it's we're huge, promotora program, how we are because of our community, but there's only 2 promotoras, case promotoras, on our staff. But we have, I think Veronica, like, and I pull out my sheet of all the promotoras that we have at community health centers in my campus. We have, I can call like 100 people, and they can come out like that. It's really amazing, and it's not because of the work we do, it's because they want to do that work. They're called to do that work. So we're really blessed to do that. My 5 minutes are probably up. Yes, ma'am? Thank you.
Answer
Okay.
Okay. Carla.
Kathy, can you take a question for the
Wow. Oh, yes, I am so sorry. God. So, everyone, oops, that's not up, but I don't want it. No, it is. Okay. Everyone, I asked each of the panelists to really think about a specific question, and June just reminded me that it might actually be helpful if I read the question, so that you all happen to be clued in to what it is that we were going to look at. So I'm going to actually change the order then a little bit here. So B, can you talk about the impact you've seen from community health workers who work in your housing development? Remember, B is from Mercy Housing.
Thank you.
Yes, Whitney will click through your slides for you.
Thank you. So, you can pass a couple of the
You're going to have something.
So we are an employee team of 3 full-time community health promoters, similar to community health workers, and these community health promoters with 3 additional staff to provide health and wellness resources, connecting residents with healthcare resources in 7 low-income affordable housing in South King County and South Seattle. So we partner with King County Housing Authority, Interim, Seattle King County Public Health, and Global to Local. We started in July 1st, 2014, and this is our regional team with 4 staff and 5 languages spoken. We're serving a very diverse cultural group in South King County. So where we have to start, in the beginning, we have to start from the ground up. So we have to build up the relationship with the property manager and the housing. We have to build in trust with the residents. We have to develop a relationship with the community partners. With the residents, we do a lot of surveys, actually 1 survey, to check about the community needs in the community. So these are the questions about the survey. So we're asking them about their basic health insurance and if they have doctors. And frequently, their emergency visit or hospital stay in the hospital overnight, and their healthy lifestyle, so that how often they eat fruit and veggies or how often they do exercise. So in the first year, we do a lot of enrolling the residents into health insurance. We open conversations about health. We provide classes about health and education, culturally appropriate to our culture group. And we partner with Public Health and Molina to offer monthly health screening with our residents. We offer a lot of physical activities for our residents, from general challenge for the kids, Zumba for young adults, and chair exercise for seniors. We also do partner with Washington State University to offer nutrition cooking class on budget for our residents. Again, most of our residents are low income. And we also support the 75210 campaign with Seattle Children's Hospital to prevent obesity among children. Since July 1st, we are able to connect serving more than 1,400 residents in South King County and South Seattle, and we engage them into more than 12,000 health and wellness activities.
it's it's very amazing for me to share the story about this group of women. It may take more than 5 minutes, but I will take as long that you'll be fine. So this group of women met to a class with Wazoo at our site. They are forming just about 12 to 14 residents coming to that class, and this lasts for 9 weeks. And after the class ended, they didn't want to stop right there. They would like to be in a group and learn more about what they need to know. So they formed their own group and named their own group as Aspire for Health. And this is a multicultural group. Now they teach every week, discuss about a topic that they would like to learn. And these wonderful women just became community health workers yesterday. They just graduated from the training. So we had 8 of them finishing the training, and now they are very ready to serve their community. So from my perspective, so we are community health promoters who come to the community to set up the relationship, to teach them, to make them choose the healthy behavior. And now they are using that message and passing on to their family, to their neighbors, and now to their community. I know at least one of them have been volunteering in Global to Local in the community in a long time. So they are very excited to share the message. So for year 2, we focus more about chronic disease prevention, fall prevention for seniors, and more cancer screening and prevention for all the residents. Yes, that's it. So when working with the community, I know that there is for people to access to healthcare, such as transportation, lack of resources, language, cultural barriers, and sometimes the treatment is free, but they don't know that this exists. So we there to help them, connect them with the right way. We start a relationship of trust with the residents, so they come to us when they have a problem. So I believe the community health promoter play a significant role in connecting the residents with the community and bridging the gap between healthcare and the community and connecting the clinic with the community. Yay.
And our next speaker, is Marguerite Rowe, and the question for Marguerite is, Marguerite, what is the most important factor in assuring CHW success? Now, King County, for public health, Seattle and King County, I got it right this time, have multiple community health workers working in multiple programs. So really having a big picture look around what's really most important.
Hi, everyone. So good morning. When we were thinking about this response, because I never do this individually, really we came up with really 4 elements that we think are really critical, and I'll spend just a little time on each one of them. Those 4 are around training, resources, flexibility, and supervisory support. So in terms of training, one of the things that we found is that it really depends on the role of the community health worker. But in addition to kind of the general community health worker training that's available, there are opportunities and needs for things like having training around motivational interviewing. So even though that person is a trusted individual from and of the community, having those other skills that will help them engage individuals. And what we find is, especially in the work that we're doing around community health workers, is often when they're hired, at least in the health department, they are hired to work on an issue-specific area. So that requires that CHW to actually know more in depth about that particular area. In addition to that, because of the way that the grants are structured, oftentimes they may need to know additional things like research protocols and understanding how to work in the research environment. So that's just kind of really glossing over at a very high level some of the training things to think about. The last thing I think that's been really important around the training is the experiential learning that community health workers give to one another. So what has been really important in our success is having actually experienced community health workers work with new novice community health workers to get them up and going and help with the problem solving. And because you're working with individuals and families, this is not textbook, right? So each of us as individuals and families have different elements and different ways of approaching things. And so understanding how to work with those individuals are really important. In terms of resources, I think that for folks who are hiring community health workers, the things to understand is it's not just about sending a community health worker out in the community or into a home. Often there are IT needs that information technology that can help really support community health workers. Clearly, if their goal is around health education, educational materials in appropriate languages are very important. Incentives. Incentives are important because depending on what the nature of the activity is, incentives need to be built in to help them help engage and connect with communities or individuals. In terms of flexibility, it's really important to have, for those of us who are hiring, I'm sorry, it's going in and out, a clear understanding of the contextual and environmental factors that impact and shape how community health workers work. And I'm going to switch mics here for people on the webinar. Okay, we're going to try this. It's important to understand that community health workers are often set out with the charge of meeting people where they are. So that may mean working on weekends, it may mean working late in the evenings, it may mean working in the morning. I mean, there are different models of community health workers, so from patient navigators who may be clinic-based to those who are actually out in the community, be it in people's homes or be it in somewhere out in the community. Having that flexibility, depending on what the goal is of the intent of why community health workers are going out there, is really important for us to understand. And to have the flexibility to adjust in our system so that those challenges around accountability are things that we understand that we need to have some flexibility as we think about the accountability of the work. And lastly, supervisory support. So there's a lot to talk about in terms of supervisory support, but most important probably is understanding the nature of the work of community health workers. Because it isn't something that is necessarily that which we are professionally trained to do. So this isn't learning how to supervise from a didactic training. Assuring, so in terms of our supervisors, what makes, I think, the team successful is understanding that the supervisor is there to problem solve, to help open doors when doors are needed, to understand the value of the work of the community health workers and how to demonstrate that to others, so that supervisors need to be that community health worker champion and advocate, as well as playing this more traditional supervisory role. And the last thing I want to say around supervisory support is clearly, and I think it was brought up that funding and money are issues. That's clearly something that we all struggle with. But in that work of the daily management of community health workers are often faced with some of the biggest heart-wrenching challenges. I think about our community health workers who are going out into people's homes. And while their work may be around maternal child health, chronic disease or whatnot, The reality is they're working with folks who also struggle with paying their electricity bills, who don't have jobs necessarily, maybe facing issues around citizenship. There may be criminal justice issues that come about. And so they both need the support to ensure that they're okay and that their health and well-being is being cared for as well. So there are so many things that we could talk about, but I think I would leave you with one last piece around understanding the work about community health workers. Oftentimes we focus on community health workers and the relationships that they have with individuals and families and communities. But in order for a community health worker to be successful, they also need to have the relationship with the agencies and organizations who are there, who run those services and support. And so they have an amazing ability to build relationships with systems as well as individuals. Thank you.
So we've heard about CHWs in clinics, CHWs in housing, CHWs in public health. Now, why would a health plan be interested in CHWs? Right? I mean, so they're like an insurance provider. Why would that be the case? Well, Kathy's going to tell us why, and she's going to tell us from an interesting perspective, because Molina not only serves Washington, but Molina, not the only health plan, but is one of our health plans that is national and that has a mandate to really look at community health workers. So Kathy's question is, in what way do community health workers help you identify and respond to the social determinants of health?
Thank you, Kathy, for inviting me today. And I would like to just echo all the comments that I've heard today. And everything I've heard people say, from the community health workers to the colleagues on the panel here, we see play out in our roles and our staff that are providing community health worker services to our members across the state of Washington. So Molina has been invested in the community health worker role for about 5 years, and it started with our New Mexico plan. We partnered with the University of New Mexico to develop a curriculum and to understand the Pomodoras and the other titles of community health workers, and to develop this and embed this as a key component of our health plan. Most health plans have always had case managers and social workers to work with our members, but we saw we needed to add this important role as part of that team player. So we've had an experience across the country of about 5 years of having community health workers embedded in our plans, and in Washington specifically for about 2 years we've had community health workers. And I'm very happy to say that we have 19 employed community health workers across the state of Washington working through Molina embedded in their community. And they are a vital part of our workforce. And every day when we start our meetings, we start with the stories that our community health workers bring back to the plan and talk about the care that they're giving to our members to keep us grounded in our work. That's what our plan is about. That's a little bit about Molina. You want to flip the slide here. So to talk about the social determinants of health, I thought I have 2 slides. One is to talk about the really tangible pieces of the social determinants of health, and the second slide will be addressing more of the intangible pieces. But our community health worker program, we call them the eyes and ears of our clinical staff. They work with and for our case managers, who are nurses, social workers, chemical dependency counselors, and medical directors. They're the people that really go into our members' homes. They meet them wherever they are in the community. Quite often, the homeless population receiving Medicaid benefits, they're living on the streets. They go to the streets. They find people. They really link with them where they are. So it's that essence of that community health worker being embedded in the community, from the community, of the community, speak the language, understand the culture, and the difficulties that people receiving quite often Medicaid benefits are dealing with. They link people to community resources, and quite often resources that you don't really think about. They know those resources, and I think someone talked about understanding and having that relationship with those resources. So they have been very creative in finding those resources and thinking about what will help serve our members. They find legal services at low to no cost, and they hook people up with those kind of resources. They not only find housing, but housing repair, people who, churches that will help people put ramps on their house, people that have become disabled because of accidents and things like that. It's school time, so they're really out there trying to help people get linked to school supplies that are offered at free no cost, and getting people ready, their kids ready for school with clothing and school supplies. Of course, they're very embedded in looking at the social determinants around transportation, housing, food, the basics. What we find is the medical teams can't be effective if people are worried about the basics, food, clothing, shelter. And so being that link to those basic needs and helping people meet those needs so then they can focus on their health care needs has been a really big part of their job. We also look at how they're linked to the other types of community services, and quite often they link people not only between providers, but help people have a successful provider relationship. Many times our members have been disenfranchised with healthcare because they have a really hard time connecting with that medical person. So they go and they're that interpreter. They help people understand more of that peer level what that provider's saying, or help coach people to have a better successful appointment instead of letting their emotions run wild during an appointment, but really help them be successful and connect with their providers. And they do a lot of healthcare navigation and understanding the healthcare system. They also reinforce from the clinical teams and help people manage their chronic diseases. And I think some of the other panelists have talked about that. So reinforcing how to take care of your diabetes, how to eat the right food, how to monitor your blood sugars, other kinds of healthy activities. And of course, what would a health plan be without talking about a little bit about cost? What we've really noticed with our community health workers in getting people connected to the right services and accessing care and those basic needs is it drives down unnecessary ER visits and unnecessary inpatient hospital stays. We really thought our program would touch the emergency room visit, and we see that all the time, but what we've been surprised about is it's really reducing inpatient hospital stays, which we weren't expecting to see as much of a change in that, but that's an unexpected happy outcome. So we can, the next slide. So when I asked my team also, what would you want me to make sure that I talk about today and bring to the group, it's easy to think about the tangible pieces that community health workers do, but there's so many intangible things that they bring to the table. And these are the words that I've captured on this slide. It's really about empathy, about being that peer, being someone non-clinical that you can talk to, that builds that trust. I've heard the word trust said over and over today, and it really is about building trust. It's about understanding and helping be a listening ear in a world of uncertainty. It's very hard, again, to connect with and manage your healthcare needs when you're worried about, am I going to be evicted tomorrow? So our community health workers do a lot with landlords and helping people prevent evictions and to be a better tenant and work with people and create those resources. The housing, so we've partnered with some of that. And just helping people understand resources. And the next level there is understanding resources that really bring positive outcomes and helping them find those right resources. And our goal for some of our community health workers is to work themselves out of a job. It's not just to find the resource and to say, here it is, let me hand this all to you, but to help people learn and to grow themselves so the next time a problem arises, they're better equipped to do problem solving on their own. So it's empowering people to take care of their lives. We see them as advocates, and that's what they want to be known for, is being that advocate and that link between social needs and medical needs. And I think the slides, Kathy, that you had about the healthcare system working in and the community health workers working out, that is a perfect slide to demonstrate the work and the collaboration that needs to happen. And then finally, what we hear quite often from our members is that they feel like they've had support and their voice has been heard because someone from their own experience has been a voice for them to really help them understand that. We have members say quite often, someone was here, they had my back, they got it, they understood. And so those are some of the tangible pieces. So, thank you. She has the right name, she just doesn't spell it right. You have two copies on this panel. Okay, so Carlos Carlos, as I mentioned earlier, has a wide range in terms of the depth of his experience, and in particular, some of what Carlos brings to this discussion is a deep understanding about behavioral health, which often our CHW world and our mental health peer supports and our recovery coaches are segmented and isolated in the same way that the rest of our sectors are isolated. So what we have to ask Carlos to answer is, how do CHWs, peer supports, recovery coaches, bring capacity to address the whole person, but even more than the whole person, the whole community? Thank you, Carlos.
First of all, let me say it's quite an honor for me to be here. And originally, I had declined the invitation. We are very busy in our area of putting together a behavioral health organization that includes chemical dependency and mental health within a public health focus in our area. We're addressing the opioid epidemic that all of us are experiencing. We're looking at the increased prevalence of tuberculosis and those kinds of activities. And then Kathy called me again, and she asked me to reconsider. And I thought about it. And I thought that if we don't get this piece right, if we don't connect to community in a way that their voice is meaningful and powerful, all the rest isn't going to have the impact we had intended. My own background, by the way, is from the Model Cities era. Any of you remember Model Cities? Oh, good. I thought we were an endangered species. Model Cities was part of the war on poverty. And so this goes back to probably about the mid-'70s. And in my first experience in community organizing was really related to bringing a healthcare clinic to my barrio in inner city Tucson, Arizona. And what I'm hearing now is a reflection of those thoughts 30 years ago. Boy, I had hair then. It was a long time ago. About a wisdom that has been going on far before that, whether it be the community health representatives in tribal systems, whether it be Dona Rosa, who knew how to, who was a curandera in traditional communities, whether it was the auntie who knew somebody at the health department to get the right license at the right time. So this is nothing new, except it's getting honored in a different way. The question, I think, about what is unique is that the concept of social determinants of health is a very fancy way of saying everything affects health. Everything affects health. And community health workers know that because they deal with real people, real time, in real life, ongoing. They live it with the people we're serving. They know that if a bus route gets changed, that will mean people are late, and they'll get kicked off panels. I'm sure not your panel, but they'll get kicked off panels, and they'll have to find a new provider. I was moved by Veronica's story about the gentleman who did not receive health care because he was afraid of being deported. The national conversation around immigration and deportation is driving people underground. In that process, the concerns that they may have, they'd rather bear than risk being deported. There are many communities that are fearful about reporting gang activities, not only in terms of the violence that they receive, but also because they don't particularly trust law enforcement. And because of that, they don't walk the street to be able to get their exercise. Community health workers know about how social determinants of health show up real time. They also know about community strength, which I think is another very important part of that special way that community health workers bring that voice forward. They know the natural support structures that happen all the time, whether that be families or religious institutions or groups. In our area, we're part of the Healthy Living Collaborative of Southwest Washington. And so our community health workers have done a variety of things. For example, Take Back the Night work in Vancouver, Washington. There was 150 residents that were being displaced because of office buildings being changed. They were there to help those folks get connected, find support. They held, they actually ended up holding a potluck at a laundromat because that's the natural place people went to gather together, at a laundromat. That's the wisdom that community health workers bring. In Wahkiakum County, the teen community health workers went to the Board of Education and had them adopt an evidence-based curriculum for reproductive health. Wahkiakum County. That's a major, major shift. In our own county, our community health workers are working to connect up residents with schools as a base for conversation about what resources are available, as well as dental services. These are not typically thought of as being healthcare. But unless healthcare is going to work, these have to be addressed as well. I would also echo what many of the panelists have said, that as every time a community health worker is successful and models advocacy, they teach other people to advocate for themselves. The last piece I think is important, maybe especially important. They demonstrate the ability of being self-directed. As communities become more and more empowered, excuse an old 60s word, 70s word, it is one of the best antidepressants out there. That sense of self-control and efficacy is crucial. It's one of the best preventive activities for substance abuse. It's one of the best ways of addressing chronic disease. As communities get the sense that they can control their own healthcare future, they feel more empowered. They act. They can do more than they've had before, and community health workers are part of that linkage and future leaders. So thank you very much for being here.
So we've looked national, we've looked county, we've looked local, we've looked clinic, we've looked housing, and all of this wraps up to what we stated as our objective for this task force to really look at actionable policy recommendations. Sometimes policy is legislative. Sometimes it's about how our organizations and state agencies work. And Representative Robinson has been asked to talk a little bit about the policy implications, not just implications, but what is it that we should be doing, and what do we want to make sure that we don't forget as we're developing these actionable recommendations for Governor Washington.
Thank you, Kathy. I want to start by saying I'm really excited for this day and to be here in this room. I love hearing all of the stories of impact on people's lives and communities around the state that community health workers are having. I have worked alongside of community health workers for decades, starting back in the 80s when nobody really knew or had heard of community health workers, even though they had been around for a long time before that. And I've also been working with colleagues from many different states around the country on the issues that this task force is going to grapple with, which are how do you take this amazing resource, community health workers, and the really transformative work that they do, and somehow find a way to incorporate it into government systems. It's a very scary thing. And I'm sure that there are people in this room who are afraid to death of what is going to happen as a result of this task force, because many people across the country resist groups like this and the work that this task force is about to undertake, because they're positive that it'll lead to ruining, I can't think of another word, but destroying the very community nature, the very essence of community health work, and that connection to the community and the strength that comes from being able to really serve your community in the way that you know the community needs best. And the fear is, right, that you're now coming into these formalized systems, we're going to put structure around it, and all of that, the good stuff, all of the heart and soul of community health work and health workers will be stripped away and gone. As I was thinking about this, I was reminded of a friend of mine, and some of you probably know her, Noelle Wiggins. She has worked also with community health workers for many years, is based out of the Multnomah County Health Department in Portland right now. And they've done a lot of work in Oregon around incorporating community health workers into their healthcare reform systems. And I saw Noelle a couple of years ago. I hadn't seen her for several years, and then I ran into her and I said, "Oh, Noelle, I've been following the work that you're doing in Oregon around community health workers and healthcare reform. It's so exciting." And she looked at me and she said, "June, it's our greatest dream and our worst nightmare." Which sort of sums up what this task force is going to struggle with over our next set of meetings. Like all things, we have a wonderful opportunity. We have an opportunity to spread the work of community health workers broader around the state, because we know how important that work is and how transformative that work is. So we have an opportunity to bring that those resources to more people in our state, but at the same time, we risk losing that community goal as we bring it into more formalized systems. So I think our job is to maximize the opportunity. We've heard all of the wonderful stories, and we'll hear those throughout the work of this task force, and minimize the risk, right? Make sure that the reason that Carlos decided to come, to make sure that the community essence is still front and center and very much a part of whatever recommendations and work that we do here. It is time to move this work forward. I am very confident of that, despite all of the risks that go along with it. Many states are ahead of us on this path, and even a state like Massachusetts, who has worked at developing policy, standardized training for community health workers for probably 10 years. They're years ahead of us, I would say, in terms of going down this road. They continually are looking again at, oh, this isn't working the way we thought it was going to. How can we change it? How can we make it better? So whatever we do in the work of this task force over the next several months, it won't be perfect, and it won't be the end. We will do our best. We will listen to each other carefully, and we will make the best decisions that we can in the context and the time that we have right now. But know that we can't be paralyzed by the fear of not getting it perfect. We need to move forward and be confident that those who come after us and the community health workers who work in the community will continue to refine and develop whatever systems and recommendations we make. So with that, again, I'm really excited, and I know that this is going to lead to wonderful results for the state of Washington.
Thank you, Representative.
Okay, I promise we're not going to be talking heads for the whole time. I guarantee it. We have some time for questions for the panelists. If people have questions, comments, good jokes. Now you know. And just right behind you.
There you go.
Is it on? Okay. For all the community health workers, all the promotoras de salud, patient navigators on the webinar, I just want to say I'm beyond privileged. I think the word is blessed to represent you. So, and I think that's the feeling for a lot of the community health workers in the room. So I just want to say thank you guys, and we will try to make you proud.
Michelle, and then I just maybe a too big of a question, but what happened with all the work, civil rights in the 60s, moving into the 70s? What happened that somebody else dropped the bomb? And I'm so proud to pick it up.
I have a point of view. Not a surprise, huh? And that is that much of the work in the 70s was really based upon social justice. And in that particular time, the political climate really did support this recognition of communities that were disconnected needed to be radically engaged. It was not enough to set up meetings in the middle of the day where people were working. Right. It was not enough to have meetings where there wasn't childcare so that mothers could come and participate. There was a change in the political climate. I think what's different this time is there's a new recognition that there is a financial benefit. In those days, there was a recognition of the social benefit. Now we get that it reduces, that community health workers, community engagement, that whole process reduces community costs. That's the driver now. My bias.
Go ahead.
Doy gracias por la oportunidad de poder estar aquí, independiente de poder hablar un correcto inglés, y por eso estas dos señoritas muy amablemente me están interpretando.
I want to thank you for the opportunity to be here, aside from the fact that I'm not able to speak very good English, and that's why these two wonderful ladies are helping me.
Y correspondiente a lo que Carlos mencionaba anteriormente, le agradezco que haya mencionado el tema de las comunidades indígenas, porque trabajo con comunidades indígenas. Soy parte de un grupo de 8 personas que llevamos diferentes servicios de salud, que diría yo más que en un contexto médico, los promotores de salud tenemos un contexto social para poder llegar a estos grupos marginados. Estas personas hablan 5 lenguas diferentes, y más que poder hablar sus propias lenguas, pertenecer a estas comunidades, ellos han logrado introducir todo lo que nosotros queremos enseñarles a nivel del cuidado primario de su salud, todo lo que tiene que ver con sus creencias, con sus tradiciones, con sus culturas, para poder llegar de manera respetuosa a ellos y poderlos introducir en el nuevo sistema, porque para ellos es un nuevo mundo. Las comunidades indígenas migrantes son personas que no están preparadas para vivir en el mundo en el que nosotros vivimos aquí. Yo enfrento barreras del idioma. Creo que hablo un muy buen español, pues 47 años de mi vida me han permitido practicarlo. Ellos están llegando a descubrir nuevas lenguas, nuevos sistemas. No se trata solamente de un sistema médico, se trata de un sistema de vida diferente. Y estos promotores de salud han sido de verdad un puente para cerrar brechas, pero es un puente sólido. Es un puente, oh, sorry, se me olvidó.
I will do my best. I want to thank Carlos for mentioning the indigenous communities. I'm part of a group of 8 people that work with the indigenous communities to helping them with the medical, social context. This is a group that is marginalized, that they speak 5 different languages, and they are integrated into their communities. So we are, the work that the community health workers, the work of the community health workers is invaluable, because they were able to introduce these people, these communities, to primary care. And not only that, the communities were able to incorporate all this into their own beliefs, their own traditions, their own cultures. With respect, I speak another language. I speak very good Spanish. I've spoken Spanish for 47 years. These people are being introduced to a new system, a new world, a world they are not completely prepared to face. Yet they are doing it wonderfully, and
with the essential work of the community health workers. They would not be able to do it otherwise.
Okay, so, sorry, Lucy, I'm going to cut you off. So we want to have an opportunity for people to actually talk together. I really want to encourage you, Tracy, I'll think on you. If you're at a table with one or two people, come, join us. It's a big discussion. Find your way around, and Robbie's going to give you the directions. First, thank the panelists.
Join this session as well. So this is just the start of our conversation. This is just to get us going. So we're going to get into the real meat of this here in a little bit. But we're going to change what we originally had as a question, which was what makes the CHW work so unique toward meeting the Healthier Washington goals. And we're going to change that question to say, why is it impossible for Dorothy and John to meet their goals without you? So I want you to have that conversation at your table. And the second part of that conversation, I want you to go into, and why does the work you do prevent it from happening again? Why does the work you do prevent it from making these things happen again? So, discuss amongst yourselves. The web